And you're looking at stats that were actually pronouncing Kenya as the third when it comes to that. I don't want to call it a pandemic because it's not been announced, but we can call it a crisis that needs intervention. What are the numbers like in the space that you're at, or what's the situation from where you sit?
Okay, so far in the country, the teenage pregnancy, we thought that maybe after COVID, the numbers will go a bit down because we recorded an increase during the COVID period. But unfortunately, instead of the numbers going down after pandemic, the numbers have still been rising in different communities. An example, Samburu, it has the highest, 57% from the data published by the Ministry of Health last year, that's 2022,
Yeah.
DHS. So the numbers are still increasing. There's a lot to be done by the civil society organizations, by the government, and also parents and communities where these girls are coming from.
This is, like you've said, it's a multi-stakeholder problem to tackle. But what would you say are the root causes? I know some are cultural. I know, some are economic. But what would you say are the root causes of our early teen pregnancy crisis?
Okay, some of the causes could be, as you said, cultural practices, like whereby in some communities, for a guy to be proved as man, they have to sleep with a girl. So the closest girl to you, it doesn't matter whether it's a young girl or an old girl, they have to sleep with that girl to be proved man enough. So there's that, and it's a cause of gender-based violence. That's GBV, so sexual violence. Then we have forced marriages in different communities, and also prostitution, whereby these girls are termed as a source of income. So they're sold by their parents for prostitution to earn money.
Even I feel like prostitution, at least, that's sex trafficking, child trafficking, right?
Yeah. For underage.
Yeah.
Because prostitution is mostly out of consent. And you get into the space as soon as you turn about 18 and over. But as you said, prostitution is also one of the causes. You're speaking, sorry, we interrupted you.
You were, yes. So those are the cultural ones in a lot of our communities. Would you say economic factors also play a role in our teen pregnancy crisis?
Yeah, sure thing. Poverty, and you'll find that in rural areas whereby most the communities are poor, and also in informal settlements, that's the slums. Teenage pregnancies are a bit higher than those places whereby it's a high-end area. So yeah, economic factors, also lack of education and information, both by parents and also the children themselves. So it leads to teenage pregnancy and engaging in unprotected sex.
Yeah, I'm looking at a statistic here. It says a total of 110,821 pregnancies were recorded among adolescents. That's in between the ages of 10 and 19 in the first 5 months of 2023, according to data from the Kenya Health Information Systems. I know that the numbers are on the rise, but as the media, do you feel like we shed more light in that we help fight enough? Because I feel like we talk about politics a little bit too much. But of course, when we saw the story just 2 weeks back, it raised an alarm. And I'd like to know, what do you think we should do, even as the fourth estate, that is the media, to make sure that the stories are well pronounced?
Yeah, so far I really like to appreciate the media because of the initiatives they have taken. An example, here I am talking about teenage pregnancy.
Yes.
So that's a yay. But I feel like media should still do more. We should leverage on our social media handles, especially those people in the media and the influencers. You can do a lot on your social media pages to talk more about teenage pregnancies. You can invite experts on the same. And then you can also do documentaries, content creation, about teenage pregnancy. You can also call on those people who have experienced teenage pregnancy, the testimonials and those stories, either recorded or you bring them live so that they can share the issues they have been through and what led them to where they are as of the moment.